Well, Dr. Higgins, thank you so much for joining me today.
Oh, it's my pleasure, Arlena. Definitely looking
Yeah,
forward to
before
it.
I hit record, I was like, "Oh, we're gonna have so much to talk about." So much to talk about because you are studying something. Listen, you're a science girl, which you have a place. I have a soft spot in my heart for women who are into the sciences because I grew up with a lot of like religion and stuff, and I just needed things to make sense.
Right.
and, and so even in recovery, I've been sober only 29 years this month, but I thank you. But sometimes I still struggle with that concept. But what always brings me peace is the science.
Mhm.
And there's always this question, is it nature? Is it nurture? And what we're going to be talking about is something that I've never talked to anybody about before, which are the biomarker evaluations that your science and research. And God bless you for doing this research. It's going to be so I feel like you're like way ahead of the wave. And I'm gonna stop talking. I'm gonna ask you a question eventually. Um, but I'm really excited about this because I feel like it answers the morality question that you hit on in your TED Talk and some of your other discussions. But but as a starting place, maybe you could share a little bit with us about what drove you to this area of research and why is this so important to you?
Sure, great question. People do ask the why behind it lots of
Yeah.
times because, as you know, as somebody in recovery, it's not a place that everybody desires. Here's where I want my career to be. Somehow they wind up there for whatever their path of life was. So mine is kind of twofold. I practicing 35 years ago in a rural area in pain management and disability. And I was seeing the one size fits all type of prescriptions being given out to people. Try this, try that, with no rhyme or reason, without knowing where we're going to end up. We're just guessing. And I started seeing people become a bit dependent that far back, 35 years ago. And
Wow.
20 years ago, I'm in an urban area. It's the same thing, only it's still try this, try that, half it, double it, let's go to this one. But I'm seeing people move from dependency to addiction at a much faster rate. And then personally, I married an alcoholic. He actually, a man who had several addictions. And we had a child together. A year after my daughter is born, we find out that my husband was adopted. Now I'm left with, okay, I need answers. I need health history. I need to know, even if people don't know their exact health history, they get to see their relatives in action, and you're like,
Yeah.
oh, Uncle Ed, he's trouble boy. He comes to the party. By the time he leaves.
We all got that creepy uncle.
Yeah, yeah, yeah. Everybody's got it. And you can, even as a kid, you can kind of start to put pieces together, but I had no information.
Right.
So now I'm like, I need to start finding out, and I'm already seeing my husband's behavior. So I'm like, I need to find out what we've got to look at for my daughter. And that was a long time ago.
Oh,
Well, that was 35 years ago. So in addition to my practice, I became a certified addiction professional, added all these other parts to having knowledge for my patients as well, but
right.
for my own family of how to deal with situations. And that just kept evolving. And
Hmm.
then the ability to look at neurotransmitters and measure them, and hormones and measure them, became more commonplace. And then it was only tail end of 2015 where the ability to look at these, what we call genetic SNPs, or single nucleotide polymorphisms, became available. So this has been just layers and layers and layers of adding to get to where we are today. So it was really two purpose. It was professional as well as personal.
Yeah, I have a couple questions for you. Because my mind always I struggle with the medical community in the sense that why aren't there protocols addiction informed? It's my understanding that there's very little addiction medicine taught in schools. And so like where is this lack of, like, I would imagine, listen, as a layperson, I would think, why isn't the medical community like, where is it coming from? Like, why isn't there, like, if somebody has pain, and we've known for decades now that some people, when they take the pain medications, if that's their trigger, like, I can't tell you how many people I've talked to on the podcast and over the years who were more or less fine, and then had an injury and started taking pain medications, and their lives were destroyed by addictions, especially the opiates. I wonder if the opiates kind of took it to the,
That's
was
right.
like pouring gasoline on a fire. But it doesn't, like, why isn't there some sort of screening, even a question like, do you have addiction in your family history, or have you had addiction before we start prescribing narcotics or pain meds? Why isn't that being
And there isn't
asked?
a standard protocol, and there's no other area of healthcare that says, "Yeah, I don't think we should do that. I don't think we should do open heart surgery here. I think we should just let them go." There's still this moral issue. There's still
Okay.
this stigma that
Mhm.
exists. That's like, you got yourself here, get yourself out. You did this to yourself, and here we are in 2023, and we're still practicing that way in the area of addiction. It could be 1950, 1970, 1990, 2000. There's nothing being done differently.
Total insanity.
Yeah, and to
Yeah.
say, yeah, I don't think so.
So
Really?
is there who would be the person or organization to be like, oh, we have a new protocol. We think that before you prescribe medication, you should be asking this set of questions. Like, when you go to the doctor now, they say, oh, have you had thoughts of suicide? Have you had more than one day? Are you not sleeping well? Like, they ask you all these mental health questions now, that like, wouldn't it make sense to have people say, do you have addiction in your past?
Obviously, it would make sense. It's funny to say that, because just last night, a therapist and also a friend said to me, I was listening to a couple of your podcasts and started saying things. She goes, everybody should have this across the board. I said,
Yeah.
every time I talk to people, that's the end. It's like everybody has said it should be a CBC, a complete blood count. Here's your red blood cells. Here's your blood.
Ah, and
It,
that is that the biomarker
yeah,
evaluations? It
yeah,
should be part.
it should
Oh,
be that.
okay.
It should
Girl,
be.
who do we need to talk to make that happen?
Then you get into the who
Is
wants
that
to
pull?
be the heavy honcho and the politics, and so I'm
Which,
kind of you know what, you guys do your thing. I'm gonna keep doing
yeah,
this.
yeah, yeah, yeah. This is good. Yeah.
You can
But if
try to,
you find a cage to rattle, you let me know.
yeah, no, for sure, for sure. Um,
Okay. But
but
let's
but
talk
that
a
but I was gonna say, but that would be it. I've had patients come to us who say, I put down on my paperwork that I was in sobriety and said, please don't give me this prescription, and was still prescribed.
yeah. I've had that happen too. I had knee surgery and in sobriety, and I let the doctor know. I said, I'm in recovery, and and yeah, they still gave me like a 10-day. But what's even crazier is they say, oh, just take it for 10 days, but they give you like a crazy amount of pills. Like, they'll only give you 60 pills. Like, what is this? I'm only going to take it for 3 days. Yeah, but we have to fill the whole prescription. We can't give you just
Right,
10
right.
pills.
Yeah, it is crazy.
Anyway,
It is crazy.
and it was actually cheaper. The narcotics, my insurance, I think it was like $2 or something like that. But if I needed something else, like an anti-inflammatory, that prescription was like $20.
Yeah, yeah, yep, and that's all the
Anyway,
politics.
yeah, this is my soapbox,
Yep.
bitching and complaining about it. Okay, but let's go back a little bit to some of your motivations, because a lot of the people that listen to the podcast, like my husband's in recovery, like I'm married to an alcoholic. I didn't see him in active addiction, but I would argue that most people have experienced that. And did you go through the whole gamut of asking those questions yourself? Like, why can't you just stop?
Oh,
Like,
yeah.
you yourself trying to, why is this happening? How can I control it? How can I help? Where is the line? When does it become controlling? What was that
Absolutely.
process like for you?
So said, because we grew up together, we were kids together, so
Oh,
knew each
wow.
other very well.
Your
And
whole
everybody
life.
was out there having a good time. It wasn't like I wasn't, hey, we're having fun with everybody else. But then you get to this point of life where you say, okay, now it's time to grow up and we have to move on, and then we get married and then we have a child and you're just, or I was just expecting that behavior to change.
Oh, to stop.
Yeah.
Yeah.
Yeah. So, um, and those conversations were had. It's like, we have a family, how can you do this? And I would just pretty much be pushed back with a blank face with no answer at all.
Mm.
We went to counseling and the counselor said, do you need help with this? Can you do this? He's like, no, I can do it on my own. Nothing changed. I
Right.
grew to hate the sound of beer cans popping open.
Yeah.
I'd be in bed and just hear all night pop, pop, pop. And you just see the pain in somebody, and I can see after the fact that that went back to this covering up and of adoption because it was
Mm.
covered up. I actually asked the question, are you adopted, before we got married?
Did you? Why did you ask
Yeah.
that?
Gut, because nothing made sense. Everybody was
Wow.
like running from reality. And I said, are you adopted? And he looked at me with this quizzical look and he's like, I guess I can ask my sister. Asked his sister, and it was a curse word back of how dare you say that. And I was there for that, so I heard it.
Oh,
I was
really? Oh, you were with him?
old school phone on the wall. And you say,
Oh, yeah, right.
and
Slammed on
I,
the receiver.
right, I heard that answer, and I was like, wow, interesting answer. Why would someone be so defensive?
Right.
And I said, why don't you call your uncle? And he's like, no, 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 I can't. So his uncle was the one who called me a year after my daughter was born to tell me. And he said, at
Wow.
your wedding, they were fighting over telling you. I mean, God bless you. You adopted someone. That's a beautiful thing.
Yeah.
To then make it this
Secret.
secret, this cover up. So when I was seeing him, now it's time to have a family and we have all these beautiful parts of our life to do together. And he is so removed. I'm like, now this makes sense. You never
Yeah.
bonded. You never bonded with your biological mother. You never bonded with your adopted mother. You really never bonded with your family. And
Wow.
you are in pain.
Oh, yeah.
Yeah.
And if that pain is probably so deep, like they say that children will dissociate. And so they don't even, like, as adults, people are like, I don't even know why I'm in so much pain or where they don't understand where it's coming from. And that's whenever I talk to somebody who says they don't have any trauma, my suspicion, and they have addiction, my suspicion is always that they've dissociated from it.
Right.
Yeah. And so he didn't have, so how old was, do you know how old he was when he was adopted?
Days,
Oh, okay.
days to weeks ish.
Right. Right. Isn't it
But
interesting?
this was trying to get records to put things together, and the records were sealed and all kinds of drama.
Yeah. Isn't it interesting now that we have the data of what happens to people under the veil of a secret, how damaging that secret can be? Like, but we didn't know, nobody knew back then. So they probably, they had good intentions, I'm sure.
Sure, you adopt a child, you have good intentions, but
Yeah.
then it's that secret gets
It's the
stronger and
secret.
stronger
Yeah. It's the
and stronger.
secret part.
Yeah.
And I've heard also that that people that are adopted have a higher percentage rate or higher risk factor of becoming addicted. Have you noticed that too?
Yes, actually,
Mm.
a case study that I used, I spoke in Abu Dhabi last year, and the case study that I used was a foster child becoming an adopted child and born to a mother who was addicted. So the baby was born in that same state and had to go through withdrawal and all the other
Wow.
things. And in school was in trouble all the time, constantly. And you're seeing that addictive behavior in a 6-year-old. The impulse control, the risk taking, the constantly looking for an argument or a fight. And parents reached out to me. This child winds up getting the student of the year at the end of the year. I
Oh,
mean,
wow.
you talk about a difference, and that's how lives can change. But it's that
Mhm.
looking at the reality instead of making believe it doesn't exist,
Right.
looking at the reality. And even her siblings, there's some biological children, some adopted children. Her siblings will say, "Did I don't want to use her name? Did she take
Right.
a histamine dose?" Because I'm seeing a difference. So even the kids know of like, wow, this really makes a difference.
So,
Right.
and what is it that made the difference? Was knowing the biological markers and
So we did the biomarker evaluation, and then we did the protocol to go along with that. So yeah,
okay, I want to dig into that too, because I think that's so interesting, the idea of having this data, because the one thing about addiction that everybody can agree on, and nobody can agree on anything when it comes to addiction, it seems like, but the one thing everybody can agree on is that it's complex.
correct. Very much.
Right. And so when I was listening to, I'm not going to try to repeat what I'm going to have you talk about it. But when I heard what you were saying about the biomarkers, and there was like 85 different markers and like the combinations, it's like, okay, well, that's why it's so complex. There's so many variables and everybody has to be treated different. Can you just explain a little bit about why like what are epigenetics, why they are important, and then kind of go into how the biomarker evaluations can inform the protocol treatment?
Sure. So as you said, we look at 85 different biomarkers. 69 of those have to do with these genetic single nucleotide polymorphisms, all that, a SNP. All that means is that there is an error in genetic coding.
In your and everyone, okay, everyone has a genetic sequencing, and
Correct.
there's an error in there. Does that mean something's like missing or
So back from science to GCAT, the way your
uh-huh.
DNA lines up, so it lined up with something incorrectly.
Inch so
So,
amazing. Like,
so
why
that
does that
creates
happen? Do we know why that happens?
no. I mean,
Okay.
I can't say why that could, and I would imagine like in the process of that, from conception to that 9 months, there's so much going on that we know
There's
and
a lot going.
at the same time. An
Yeah.
incredible period of time for a
Yeah.
person. But anyway,
Okay, so
so
it's an error in
right.
the
So
okay.
that creates what we call aberrant behavior. So aberrant behavior is things like
Wow,
risk taking, impulse control, addiction, anxiety, depression. So
amazing.
we isolate, we identify, and we measure where these are. So if we now know here we have an error in this part of the coding, well, we look at the biochemical pathway for that and say, why aren't we getting to the end correctly? Where are we having trouble? So that's kind of the Cliff Notes version of all that goes on in there of making it as simple as possible. But you know, and nobody has this perfect DNA, right? Everybody's got
Right.
some, you know, some families it's cardiovascular disease, some families it's
Right.
cancers, but those people get to know that. You know, it comes to addictions and it's like, let's not talk about it. You know, it's like
Yes.
if that's in you, if mental health, addiction, and almost everyone has a co-occurring disorder. And I say it's either
Yes.
been diagnosed incorrectly,
Okay.
not diagnosed, or we have a trauma, or we have all of it. And that epigenetics portion of it, so here's your DNA, play it out. The way the environment interacts with our genes can turn those genes on or turn those genes off and change the expression of those genes. That's
That's
epigenetics
wow.
in a nutshell.
So that's like if I experience trauma as a child, if I have this error in my sequencing, that means the environment triggers something in my genes, so that, and let me just see if I can play this out. It's like my something about my DNA is not creating the neurochemistry that would prevent. Is it like not producing enough serotonin or dopamine or and then because I don't have what I need in my neurochemistry, my brain finds a way to adapt, which is to self-medicate with different kinds of drugs. Is that a fair assessment?
Perfect assessment. And when people will say, well, why is it alcohol, or why is it this, or why is it gambling? It's like, because that individual is trying to self-medicate and they don't even know that. And
Yeah.
what do they attach to at that age that says,
Mhm.
This is where I feel good." And it works until it doesn't work. Right?
Yeah. Yeah.
Initially it works and you
Yeah.
feel good. And then it's like,
Yeah.
whoa, this is my next problem.
Yeah. I think at the end of the day, what people are seeking is relief.
Correct.
Right. And so
Yeah.
like that was my experience. I started really young and my first experience was with alcohol. I think it was just below the age of 10. I'm not quite sure how old I was, but that feeling of relief that I had. And, my parents had divorced. I had some other things in my childhood that were traumatic. Do you know that there's nobody else in my family that has addiction issues? It's just me. I used to say there's a lot of addiction in my family, and you're looking at all of it.
Very good. Very good.
Yeah. But it makes so when I hear this as somebody that struggles with addiction, I think, oh, it's not my fault. Like there's so much shame and guilt, even though nobody else is telling me that that I'm a bad person. It's like I feel like I'm a bad person because I don't behave. I can see how like I had a sister who was really good. Like she followed the rules and she did not have abhorrent, what did you call it? Abhorrent behavior.
Aberrant behavior. Yep, yep,
Thank
yep.
you. Yeah, she didn't have that. It was all me. And so I felt bad, but then
Sure.
this information, like this is what I love about science. It's like, and I understand that it's not my fault, but it is my responsibility. Like that's what helped me get recovery. But there is something so that like gives me that deep peace. It's like, okay, it's not my fault. It was my genetics. There was something missing but it doesn't mean that I can't get recovery.
Exactly. And that, for a lot of people, Arlene, I can't tell you the amount of people that start crying when they
I
see
know.
that,
I
but
know.
from relief.
Really? Yeah. Finally, somebody understands
Not, and
me.
I say this in air quotes, crazy, right? This right here,
Mm,
this says like, oh my goodness. And then family can wrap around and support that, saying, wow, we were just thinking you were trying to like always be the one who's creating the trouble, creating the drama, and it goes on and on. And it really changes things, and it removes that stigma. It
wow.
removes that moral part.
Yeah.
And you still, as you said, you are now still responsible, right? You
Yeah.
don't
Yeah.
still have free will. You can do whatever you want with this information, but
Yeah.
now you know why,
Yeah.
right?
Yeah. I think that's so powerful about this approach and looking at it through this lens of, let's the biomarker evaluation. That is just amazing because then it's like, oh, we can identify what you're missing. And let's talk about like the protocols to replace what was missing or whatever what your next step is. But just that initial period, because it is the family that is looking at you like you are crazy. Like I frequently got that from my parents. It's like, why, like the confusion and the exasperation and the frustration that they were feeling. It's like, why can't you
Right.
just not do this? Or why can't you just do this? Or why can't you be different? And you get that message. Oh, and listen, that abhorrent behavior was just being displayed since I was very young, right? So it's a lifetime of people misunderstanding you.
Right.
And
Right.
then then you start self-medicating and you feel that relief. And then, but I can't imagine, do you often, the person addicted is feeling, they have tears of like, oh my gosh, I'm not crazy. Finally, somebody understands me. It's not my fault. Do you find that the families often feel guilty for their
Um,
part in this?
Guilty might be strong. There's an understanding now with a sprinkle of guilt. You
I
know,
hope they feel guilty.
there's an understanding, and all of a sudden now, wow,
They're
wow,
like,
a
oh,
lot of
it
wheels
wasn't.
turning and a lot of thinking.
I wonder if the guilt sets in after they leave your office, after they have a minute
Oh,
to think.
I mean, I would imagine the conversations just don't stop, because I always end it with people. We just talked about a lot. So this is a
Yeah.
lot to take in. So just,
Yeah.
Process it. And, any questions you have, let me know. But yeah, it's a lot to take in, but all of a sudden it makes sense.
And
It's
all of a sudden it makes
a
sense.
disease, and there's still people that want to say it's not a disease.
It's so crazy. Those are people are just uneducated. Those are
Yeah.
people like I recently saw something on social media, by the way, that is a whole nother ball of wax, but because I think that plays a part in people's mental health and that can be super
Oh my
triggering for a lot of people.
goodness, does it?
But somebody was discussing somebody who had died of like overdose. I mean, there's so many celebrities for heaven's sakes that, suffer with addiction and then they die, and then people are like, oh, they did it to themselves. It's just a uninformed perspective, and I just don't have the energy to correct everyone at this point. But
Right. In my TED talk, I say, if someone has diabetes, we don't say, why are you so weak? Yet with addiction, it's okay to say that to somebody.
That is
It,
so hurtful.
it's just incomprehensible at the inequity that exists within this area of healthcare. It's like we don't even call it healthcare. It's bizarre.
Yeah, it's bizarre on many levels. Yeah. And what's really interesting to me is people with struggle with addiction have to endure a lot of pain, right? So I think their threshold for pain is really high because, the things that I had to endure to continue the painful lifestyle that I led, I had to be really strong in a lot of ways to endure.
Absolutely.
But what I couldn't face was like the emotional pain, all the internal shame and guilt and thinking that I was crazy and feeling broken. That was the hard part.
And then to be on the other side of it, so often people have no idea that the rest of the world doesn't feel the way they do. Because if you've been feeling that way your whole life, you just assume, well, this is how everybody feels, and they're just being stronger than me, and I'm being weak.
Right. Yeah.
So then you get to the other side of that, you feel different, and it's like, oh, whoa, whoa. And then because of the complexity of this disease, you still have a lot of work to do emotionally.
Hmm.
If you started drinking at 10, 15, well, you may still be emotionally 10 or 15.
Right.
But
Yeah.
every time it was time to grow up in a situation, you reached for something that was going to self-medicate you.
Right. Yeah.
So it's a very complex disease, and it's
It's very
biopsychosocial in a triangle. And the
right.
bio part, we say, well, make sure that you sleep at least 8 hours a day and drink plenty of water and eat well. And, that's the bio. Like, guys, we have advanced so far in science. Bio should be looking at someone's physiology the way we're looking at it with the Wired for Addiction
Right.
panel. That should be the bio part. What's
Right.
your physiology? Not the next guy that's being treated, but what's your physiology?
Exactly. Tell me a little bit. So let's get into the biomarker evaluations. Like, what are they looking for? And then what are the protocol? Like if you're missing serotonin or like what neurotransmitters are you looking
Sure.
for?
So neurotransmitters wise, serotonin, dopamine, GABA-amine, and butyric acid, glutamate, phenylethylalanine, um, the list goes on and on. Then we look at
And these are
hormones.
responsible for emotion regulation. Is that right?
So there's a clinical correlation to every neurotransmitter, be it too high or too low than where it should be as the norm.
And how it affects you emotionally.
Right. Interestingly enough, just use the example of serotonin because most people are familiar with that because we have so many SSRI drugs out there. People know that buzzword. And you
What
can
does
have
SSRI stand for?
selective serotonin reuptake inhibitor.
Okay.
So, so you so you have too much or too little serotonin, the agitation and anxiety looks exactly the same.
Wow. If it's too much or too little.
Yep.
And let me ask you, this is what I'm always curious about is people ingest alcohol or drugs that goes through your digestive tract. And then I learned that most of your serotonin is produced in your gut.
Yeah,
So is
80%.
the 80%?
Yeah.
So is the alcohol killing the serotonin like a bacteria or how does that work?
It's not allowing the normal flora to create what it should be creating there. in your
It's
gut.
the flora that creates the serotonin.
So it's not able to create what it needs to create. So going back to
Wow.
that example, say of serotonin, I can't tell you how many times when we do someone's labs and they've been on an SSRI drug for 10, 15, 20 years, which it was never designed. SSRIs were not
Right.
designed for that. They were designed for an acute situation in your life.
Hmm.
Now they're used for chronic, another soapbox because they became such a moneymaker,
I
right? Let's
know.
just hand them out like candy. And that that person's serotonin's in the tank. I'm like, first off, this did nothing for you except stress your liver, your kidneys, your bladder, did nothing for you. Then we do the SNP portion of this and we see that they have the gene that is going to make an SSRI drug ineffective for them. So all these years they've been on it, nobody bothered to look at this. And then what happens to that person emotionally that has been doing this for so long? And I've tried everything and we've doubled it and we've halved it and we changed it to this one, that one, and that one. Do they start to believe that it's them? Yes. Deep
Absolutely.
down, they're like, I just don't want to be better. I'm a problem. Would I be better off not even being here? And then go through that
Oh,
whole emotional part of this.
yeah.
And it's because no one clearly identified where our problems were. Or, you know, depression could be from serotonin, dopamine, norepinephrine, epinephrine, one of those, two of those, three of those, four of those. How do we know? If we've done no objective labs, how do we know what we're prescribing? We're prescribing based on someone's vocabulary. What if
Mhm.
you and I, Arlena, don't have the same vocabulary experience and we use different words? We're going to wind up in a different place with that
Absolutely.
prescription,
Yeah.
right?
Yeah.
We can do better than that. Yet we choose.
Because all of that is subjective, right?
It's all subjective.
It's all, it's all
All
subjective.
subjective, but what we're doing is objective. Here's markers,
Objective.
here's data points.
Ah, there, that gives me such peace knowing, like, because it's about the source of truth, right? And that's something that we in our society are lacking, is the singular source of truth. And, the biomarker evaluations would be a clear source of truth.
Absolutely.
And we can build a foundation based on truth
Right.
rather than subjective guessing. Because that's what I see. I have a family member on SSRIs and has been for quite some time. And, as a parent, or I worry about, my family, and what the long term, but there is, and it's a try this. It's just like the pain medication, try this, try that approach.
And speaking of truth, I'll throw this out there because it usually makes people think. With the opioids, we use 80% of the entire world's pain medication in the US. We make up 5 to 6% of the globe. We're using 80%. So that begs the question to me, is our pain physical? Is our pain emotional? Is our pain intellectual? Is our pain spiritual? I'd say it's all of it.
All of it.
Because we are trained to say, here, take this. You're in pain? Overrated. Take this. Right? Instead of, all right, let's figure out objectively where
Objectively.
everything's coming from. And then what do I have to do? Back to those 4 pillars. What do I have to do emotionally? What do I have to do intellectually, spiritually for myself?
Right.
We know simply that, if you exercise, it's going to raise your serotonin. Say this that somebody's like, yeah, but I really hate doing that.
I'm raising my hand on a podcast. Me, hate it.
On a podcast.
I have such a love-hate relationship with
Yeah.
exercise.
But it's those kind of things. It's like there's also like, what are you going to do about it? What are you going to do about it?
Yeah.
Here's
What are you gonna do about it?
information. What are you going to do about it?
Okay, so can you walk me through? So someone comes to you. I want to send everybody I know to you now.
Well, good. I mean, that's, honestly, that's what everybody winds up saying, but it's like, that's how we get to the point of this should be mainstream. This should
It
be
should.
your CBC.
Yeah.
Great. You have this many red blood cells, terrific information, but I'm struggling.
Yeah. What? Yeah. Yeah. Because then it's like, okay, now what?
Yeah.
Like, okay,
What?
so somebody comes to you, they do
Yeah.
the, by the way, should we throw out the website?
Sure. Sure.
Okay.
Wired for Addiction, all spelled out, wiredforaddiction.com.
I will be visiting this website. directly. I would like to know what's going on in here.
And then we work with people globally. So we drop ship the lab kits to the individual.
Oh,
And
is it a blood test?
it's the buccal swab is for the
Oh,
polymorphism part
is
of
that
things.
all? That's
Yep,
amazing.
simple,
Oh
right?
my gosh.
Yep.
That's like the 23andMe. They send you this spit thing.
Yeah, I mean that's what we'd call a recreational lab. This is
Yes, it is
right.
recreational.
Yeah, yeah, yeah. I mean, but it makes for good banter, and with something like that, they'll just say, well, they'll look at one gene and say you don't have a propensity for this. That can be good and bad information, because there's a lot
Without the,
one than that
yeah.
one gene. But
Okay.
side,
Okay. So
um,
somebody gets
right,
the test
right,
and
right.
you
Everything
get,
from the office. Here's the instructions, pre-collection, just like you're doing any other lab work. 48
okay.
hours before, don't eat this or don't drink this or whatever the case may be. Do your samples. We get them back 2 to 3 weeks later. From there, we create a biomarker evaluation report, very extensive, like 31 pages of the genes themselves, and the entire thing is like 70 some odd pages, but it's a lot of information. We then have a very extensive appointment virtually, where we go over each one of these individual biomarkers that we look at, what it means. Is it where it should be? Is it not where it should be? And if it's not, what we need to do to make corrections to that. Could be pharmaceuticals, nutraceuticals, combination of both. Everybody's
Nutraceuticals meaning like a diet and supplements.
diet, pharmacy grade supplements, not just kind of over the counter stuff, because that's a whole nother.
Yeah, the FDA doesn't regulate those, so you're looking for
You
high
could have
quality.
1% of what their label is, and that's not going to do anything for you. And that could be another, like, well, I took that, it didn't do anything. So pharmaceutical grade and or pharmaceuticals, combination thereof, just depends on that individual's lab results,
It
because
depends.
it's the same.
Yeah, it
So,
depends.
right, it depends. So then with that, if you just want the biomarker evaluation, there's your information. If you then want treatment with that through the protocol, we work with people over a 6-month period of time, meeting
Okay.
every 2 weeks with here's where we are on the protocol. We do it in phases, typically 4 phases that we go through.
Oh,
Um, the first thing is symptomatically, you start to feel better. And then we bring in the support for the genetic SNPs. And then if we need any layer of pharmaceuticals, that's our last phase 4.
that is so interesting that that's almost opposite of what the normal protocol is. And we all know that the normal protocol is not working.
Not working. I would
It's not
never
working.
have wound up doing what I do. Had those results, and I say this in my TED talk, I say, had those results been good, I would never be here today. I would
I
never be
know.
doing what I'm doing, because that would be good. Like, keep on
Mm,
doing it. It's working, but it
yeah,
doesn't work.
it doesn't work.
It doesn't work. And there was something else I was going to say on that.
Oh, I derailed you, but we were talking about the 4 phases.
Right. So oftentimes by the time we get to phase 4, we don't even need the pharmaceuticals brought in.
Isn't
And
that
here's
amazing?
the thing, it's like there's not a single cell in your body made up of a pharmaceutical, yet that's the first go-to. We have been brainwashed into believing that. And I am not anti-pharmaceutical. There
Yeah.
is a time and a place, but should it
Yeah.
be jump to it, or should we figure out why whatever is happening is happening?
Yeah. Yeah. I'm all about let's address root cause. This sounds like root cause
Absolutely.
to me.
It's root cause.
It's root cause.
It totally is root cause. So interesting that so often we don't even have to get to that 4th edition of adding the pharmaceutical layer, because we've been supporting the pathway in everything that it needs to get it operating.
So when the body has what it needs, then it can carry out the functions as it was designed. And
Absolutely.
ultimately it corrects the destructive compulsive behaviors
It wants
and
to return to that homeostasis, that balance. Our
right.
body always wants to get back there.
And you mentioned a couple of other components, like, and I'm accustomed to in recovery, people talk about the spiritual, emotional, mental. It's like, like you talked about it, the whole combination. During once you have sort of this, foundation built on truth and science, and things are being added as needed. Um, are you suggesting or recommending people start a spiritual practice? And I'll just clarify, we're not talking religious, we're talking
Oh,
spiritual.
sure. Yeah, for sure.
Yeah.
That's it.
Is, yeah. Do you,
Yeah. Even during that, even during
from
our
the
work,
very beginning?
if you're, some people come to us, we work with individuals that come to us directly. We work with therapists, coaches. We work with treatment centers. We work with the justice system. People even in prison, we
Oh,
treat.
yeah. Oh,
So
yeah.
yeah, so you all of these different aspects that you come into it, stay with your therapist, stay with your coach, keep doing all these things. This is just going to elevate where you're at in your talk therapy that you're having with someone, because there's no barriers anymore. You're where you should be. You're hearing it. You're acting and reacting to new information that that individual has been trying to say to you forever, but now you're hearing it for the first time.
Yeah. Now you're here. Isn't that so interesting? I mean, and that explains sort of like this phenomenon that I hear in like 12-step meetings. People read this same literature over and over again. And as they grow and evolve and change, different things hit them differently. Right. And it's almost as if, as your body heals, as your mind heals, you're able to receive new information.
Exactly, exactly. And whatever that practice is that keeps you grounded, whether it be being out in nature, for me, that's it. That's my
I
quiet.
can't tell you how often when I ask people, like, what do you do for fun these days? People always talk about nature.
Yeah, yeah, that's my go-to. But to find your go-to, whatever it is that brings you back and says, "Oh, that's just nonsense, whatever went on," and let it go, instead of going to the old knee-jerk reaction of, well, it was go to the bar, or go pick up a
Right.
bottle of whatever, or you know, light it up, whatever the case may be. Um,
Yeah.
but to have that, what works for you. Again, we're all individuals, 7.5 billion people in the world. Yet
Yeah.
when it comes to healthcare, it's like, okay, we're all the same. So you do this, you do
So
this.
crazy.
It's
So
crazy.
crazy. Well, I wonder what it's like for you. I mean, you're offering the help that you and your husband never got. What is it like for you to work with the families and see the changes in the families?
It's beautiful. It's beautiful because, as you know, it's not just that individual that has the addiction or the
No.
mental health concern. It's the domino effect of
Yeah.
every life that they touch as a result of that. So that one life is changing countless lives, countless.
Countless. Yeah. Yeah. I mean, it is painful to watch somebody you love suffer,
Yeah.
right? And when they stop suffering, that is very healing for everyone.
Right. And it's kind of like you go through those stages of grief and dying, the Kubler-Ross, right? It's like, first the frustration of, you want to shake them and say, look at what you're doing. Why are you doing this? And the anger and the resentment and the acceptance of, okay.
Yeah. Yeah. Well, listen, I'm so grateful for this work that you're doing. I mean, this is truly revolutionary. This is truly a game changer approach. And, congratulations on your successful TED Talk. I think it's going to do a lot of good for a lot of people. If somebody wants to reach out to you, is the website the best
Website's the
place?
best way. Yep. Website's
Okay.
the best way.
Wired for Addiction, and for is spelled out,
Yep.
wiredforaddiction.com.
Correct.
Is there anything I should have asked you that we didn't talk about?
No, I think you're
I
great.
think we covered all.
Yeah, absolutely. I think very personal, and then you got to have like the science part of it in there too. So really good job, and keep on,
Oh, thanks.
because this
Yeah.
is how people hear it.
Yeah, it really is. Yeah. So I get a gold star is what you're saying.
Or, well,
So I'm a validation junkie. Um, well, Dr. Higgins, it was such a pleasure to talk to you this morning. Thank you so much for all the work that you're doing. I think this is really exciting, and you're going to help a ton of people. So thank you so much for your time today.
Thank you, Arlene, and keep on doing the work that you're doing because this is how people hear it.
Yes, ma'am.